I think one of the areas in which the scientific and medical communities have struggled in terms of communicating a message is Barry mentioned at the beginning. We spend about 18% of the gross domestic product on health. Most countries spend 10 to 12%. So as we invest more in basic science research, is spending on overall health only going to go up? This really creates a disconnect for health economists, health policy, and politicians who ultimately write the checks for all of this vis-a-vis our own dollars. I don't think we've done a very good job communicating the statements that the healthcare system in the US isn't very valuable. We don't do value very well, we do volume well. But could you invest more money in us in terms of research? There's a disconnect, I think, and when I've had the opportunity to speak with politicians, they struggle around that disconnect. And I think we need to be clearer about what the value is in investing in research and disconnect that from the cost of overall health care. And I think it's a very difficult message to go.
Otis, what's your policy takeaway?
Howard just struck on something there. I think that we should think of research spending as an investment. And that we in science and we in medicine perhaps have not explained to the general public how that investment has paid off, nor have we explained how that investment can pay off even more. And when I say investment, I'm talking about an investment in basic science and understanding of what's going on, as well as an investment in application of the science that we learn. I spoke already a little bit about that, but there's so much of what we have learned that the population as a whole just doesn't benefit from and doesn't even know about. And by the way, as we learn more about basic science, I learn more about how to prevent disease. So think of science as an investment, communicate what the payoff actually is, and we can increase value. I, like Howard, am very worried about the fact that we're the only country that spends 18 cents out of every dollar on health care, and the number 2 country does spend 12 cents out of every dollar on health care.
But can I just add one thing to that, because you're absolutely right. We spend the most, and by many measures we perform in a mediocre way. But if you add the investment in healthcare plus the investment in the social determinants, it's a wash, meaning we spend the least in the social determinants of health and we spend the most in healthcare compared to countries that are spending relatively little in healthcare but a great deal more in the social determinants. So I think the question that we have to look at as a society is, what is the right balance? This gets at health disparities, but it also gets at the broader determinants of health that really are the driver of many of the chronic conditions that we're struggling to pay for today.
Just social determinants, behavior, what exactly do you mean by social determinants?
Yeah, the social determinants, the behavior, the lifestyle factors, the tobacco use, beyond that, the socioeconomic status of people in the society, and how that translates into policy issues are, for example, how much paid time off there is for parents to raise their newborn children or their adopted children, and how much does the community invest in supporting home care or the ability of people to maintain healthy lives in their own domiciles? Those kinds of investments, which we don't factor into our healthcare spending, are actually very important to keeping people in a healthier state, a more ambulatory state, a more productive state, and we need to look at the whole picture. Just look across the OECD countries, and I think it tells a story if you factor in the social determinants investment.
Are you saying you're going to pay to prevent, or you're going to pay to treat? Your choice.
Well, I'm saying that if we reinvented our communities to create health instead of wasting it, we would probably need to spend less on both.
Okay. We're in agreement, I think.
So you have the last word here. What's your takeaway
The team should
for
have
us?
the last word.
If I had a wish, it would be to be able to share both with our representatives in Congress and the public at large, the excitement of what is happening, what's in the test tubes in the great academic medical centers in this country, and to get an appreciation of how valuable what we do is to the lives of people in this country. It hurts me deeply when kids are not vaccinated with the cheapest possible, most effective tools, for example, to prevent liver cancer with hepatitis B, or human papilloma, HPV, to prevent cervical cancer in girls and head and neck cancer in boys. And we're not doing it because the message hasn't gotten through.